Oh, you know what? It says, you know what? It turned. Okay, you're on.
All right. Well, as you can tell by my props, you can tell I'm going to talk dental here. This reminds me of my grandfather's teeth. Whenever I was about 3, he used to snap them out at me, and I thought it was the coolest thing ever. So I had to bring him and show you. No, he was a big man. No, he's a... The first question I just want to ask you guys, I'm going to start out by asking you, what kind of dental patient are you? Are you one of the kind of dental patients that you love going to the dentist as long as someone else is in the chair? It kind of reminds me of a joke that I read online. There was a man and his wife, they go into the dental office and the man says, "Doc," he says, "I need a tooth out. The only thing is I want no Novocaine, I don't want laughing gas, I want nothing. I need it out fast because I have a lot to do. Can you do it?" And the doctor looks at him and says, brave man, huh? And he says, "Well, I don't know. Open your mouth and show me which tooth is bothering you." And he turns to his wife and he says, "Sit down, show him which tooth is bothering you." Isn't that how we all are? As long as we're making an appointment for someone else, then we don't mind going to the dentist. I've been in dentistry for 10 years, and I can't tell you how many times I've heard a patient say, "I don't think I have dental issues because I have no pain." Well, unfortunately, by the time a tooth begins to cause you pain, you either need to have the tooth extracted or it costs a lot of money to save the tooth. Nobody should have to go through dental pain, and every person should have a yearly dental exam for preventative maintenance. Preventative maintenance will save you time, money, and hours of needless pain. Today I'd like to talk to you about your dental health, why a yearly exam is important, and how your dental health can affect your overall health. First, I'd like to talk to you about how often you brush your teeth, and I'll show you some quick techniques, and this is like a crash course in dentistry. It's really going to be quick because of time. But according to the American Dental Association, you should brush your teeth twice a day. If you do it 3 times a day, that really isn't a big deal. The more, the better. The big thing is to use a soft brush and not to use too hard of a brush. They suggest you floss once a day, that you have a professional cleaning twice a year, and that you see a dentist once a year. And so, I just went. So anyway, I'm going to start by showing you, taking my teeth and showing you quickly some techniques. Whenever you brush your teeth, a lot of people scrub, like you're scrubbing the bathtub, and you don't want to do that. You want to hold your toothbrush at a 45-degree angle, and that way you want to go in a circular massaging motion so that the bristles get up into the gum line. Whenever you think brush your teeth, think brush your gums, because that's really where plaque is built. And the reason we brush our teeth is to remove plaque. If plaque stays, it'll harden and it'll become tartar or calculus, which usually can only be removed by a hygienist. You want to, all the way around, once you get to the top on the inside, some people have problems with the inside. You want to use the tip of your brush and still go in that circular motion, and you want to do it on the inside, outside, and then you want to work on the surface of the teeth. The next thing I want to kind of show you real quickly is on flossing. A lot of my patients complain because when they go to floss, they're not able to hang on to the floss, and it's just really frustrating. So I want to show you a quick trick. If you'll just double it and tie it in a knot. Gives you a nice little handle to hang on to, and then you're able to floss a lot easier. And when you floss, you want to go up and down, never back and forth where you cut the teeth. Now that we've discussed ways that you can clean your teeth, you're probably wondering why you need a hygienist. And once again, just as a reminder, plaque that goes untreated turns into calculus. And that is a really hard, sticky substance. And a hygienist will use different methods to remove that. A hygienist is key in preventative care, because you need to have the calculus and tartar removed. And they have several methods they use. There's scaling, where they take a sharp instrument to knock the tartar loose. They also use high-powered water pressure to knock the tartar loose. Plus, they have 2 different types of polishing. that also takes care of the tartar. A dentist is also very important in preventative care. The hygienist will take x-rays. She will look for, she'll measure gum disease and look for bone loss. And the doctor will come in, read those x-rays. A lot of times they have different tools that look for early decay. If you catch decay early, then it saves you money, time. A tooth that has a small filling costs you a couple of $100s to fix. A crown costs you about $1,000, and with the buildup, sometimes even up to $1,200. So it really is important to go in and to take care of preventative maintenance. Preventative maintenance is a doctor's way, dentist's way of saving you money. Not only in taking care of your dental work, but also in preventing major health issues. Some of the health issues that have been linked to dental care, obviously, is oral cancer screening. A person dies in America every hour from oral cancer, so it's really important to have that yearly screening because it's a very treatable disease. Another thing that has happened in the past, I read a story, I did a paper on a young boy that got an abscess and it went to his brain and he passed away. So dental issues are very, very, very important. And one of the last things that is a major issue, the American Heart Association has connected heart disease with gum disease. A lot of their patients who have gum disease have heart disease, and heart disease, they have gum disease. Because whenever you get your teeth cleaned, your mouth is full of bacteria, and anytime you have dental work, bacteria gets into your body, and it can turn into bacteremia, which is bacteria in the blood that can infect your heart, and it can cause what's called endocarditis, and it can eat up your heart valves. I have firsthand experience of this. In 2005, my husband had his aortic valve replaced a year after he had a cleaning, and this was a year long. He got very sick, so I know it can do it. And it is very, very important that you get your dental work taken care of. I have a friend, she has this kind of sick joke. What she says is that heart disease doesn't hurt until it kills you. You can live without your teeth, but you can't live without your heart. And so I'm going to close by just telling you a quick story. I had a patient come in a couple of weeks ago. She had had decay that she had had for over a year that she knew about. And it started giving her trouble. She started getting a toothache, so she went to a dentist on an emergency basis. He gave her medication, and she was headed home through our town, and her tooth began to swell. So she came into our office, and within an hour, her jaw swelled 3 times its size. And it started to interfere with her airway. So she was rushed to the emergency room because she was in a very dire situation. And so, I don't want to see anyone here be one of those patients. I'm in dentistry because I love what I do and I care about people. And it's very, very important that you take care of your dental issues. That way they don't become health issues. And that's all I have. Thank you very much.